I'm the proud owner of Prime Care and Pathology. Let me start by saying that pathology, which is my specialty, is a positively predictive specialty of medicine. I started a general medical practice in downtown Atlanta on Cleveland Avenue. And it was called, I still have that practice, it's Medical Diagnostic Choices, or MDC Atlanta. And what we do is, again, we embrace general medicine and pathology with the notion of focusing on preventative care, helping people reduce suffering and prevent some of the complications from chronic diseases. So that was the focus, or at least the mission of Medical Diagnostic Choices. So what does a pathologist do? So a pathologist uses laboratory techniques, like typical of a scientist, using beakers and test tubes and all that to study blood and cells and tissues and organs to determine what's going on with those particular organs. One of the things I decided to do is to assist patients with knowing their numbers and knowing where they are in terms of risk. About 15, 16 years ago, I had this idea that really developed out of a laboratory that I was the medical director of. We had about 300 employees who we did lab tests on them. So we did some basic chemistry, some CBCs, just to see where their numbers were. And so I was surprised to see the number of persons who came back to ask me questions about what did the lab mean for them in terms of their risk. And so I got this idea, well, if I can go directly to people to explain what lab data would be, that will kind of, give me a presence among the public. In America, we have a sick care system, and so people are often told that they don't really have to see a doctor until they have symptoms. But by the time you develop symptoms, usually it's too advanced and too late, and you can't do anything about it. I try to tell people that they can be in the driver's seat by. Hey, our big celebration today out in Conyers, Georgia. Saturday, June 18th with Juneteenth weekend celebration. We're ready here. And for you to come out, get your free lab check, get your blood checked, have a conversation with me. You can walk in, we got music going. I turned it off for right now, but you can come in, take some goodie bags, get something to eat. We're still setting up for the food. Get something to drink. Come and take a look at my office, and let's have some informative discussion here. We'll talk about how to prepare food safely and effective for persons who have certain high risks, like diabetes, high blood pressure, high cholesterol. You're gonna have a conversation. We'll get your weight. We're gonna check your blood pressure. Come on out.